Hi, greetings colleagues. My name is David Owino and I'm the One Health Specialist for VSF Germany. I'll highlight on participatory disease surveillance. But first, let me give you a context of where we work. So we mostly work in the micro and meso levels in the counties of Turkana and Marsabit counties. So this is mostly on a pastoralist setup where communities rely on livestock for their livelihood. So over the recent past, these communities have been affected adversely by the changing climatic patterns and especially on the increase in the frequency and the intensity of drought. So this has caused severe public health and animal health challenges. For example, unusual migratory patterns in search of water and pasture, an increase in disease-causing vectors, emergence of new diseases in new ecosystems, and a general increase in the prevalence and incidence of diseases like Rift Valley fever, leishmaniasis, trypanosomiasis, as well as rabies. So what do we do about this at VSF Germany? So we have a One Health program which sits on 4 legs. And these are neglected tropical diseases, AMR, food safety, and emerging infectious diseases. So these are rather broad topics, but for today, I'll focus on participatory disease surveillance and how is this structurally set up. So at the micro level, we have community health volunteers and animal health workers. So these are the backbone of PDS. We do a lot of capacity strengthening on integrated disease surveillance and response, and ensure that they are aware and they know the case definitions of the diseases which are likely to occur in their areas. So this is led by the veterinary epidemiologists on the vet side and the disease surveillance coordinators on the human health side. Now, the next level is the meso level, where we support the One Health steering committees, comprising of both the government actors and the private actors. And this is where the response is coordinated from. For example, if a report from the vet epidemiology or the disease surveillance come to this committee, they discuss over it and decide on the best course of action. If it's further investigation, for example, or if it requires a joint response from the animal health and human health, then they are able to spearhead this. For example, if there is a reported case of or suspected case of rabies, they're able to organize animal health workers to do dog and cat vaccination, community health workers to do sensitization to the public on how to control and prevent rabies, and also on the environmental components, they do a lot of cleaning on the garbage points, which are likely places where dogs meet, and increasing the spread of or likelihood of spread of rabies. So what are the reflections from this? One, we need to have more policy discussions to ensure that One Health approach is entrenched into law to better address these One Health challenges. 2 is technology integration. We need to develop and digitize the surveillance process for better efficiency in the response and also for scale in the region and linked globally, because some of these diseases are transboundary. 3 is on public-private partnership. We need to work together better to operationalize the One Health in the different areas. And 4 is on gender mainstreaming. This mainly bringing women and youth on board in One Health responses and also in participatory disease surveillance. Thank you very much for your attention.